If you're a nurse looking to bring in additional income, you're not alone. According to one survey, 50% of nurses in the U.S. have a side hustle. For many workers, picking up even a small side gig can make a significant difference in their budget and savings. Plus, you can expand your skills and explore different fields. It's a win-win. Whether you're looking for extra hours in patient care or hoping to apply your nursing skills to a different line of work, here are some of the best side hustles for registered nurses to explore. 1. Adjunct nursing instructor. Adjunct nursing teachers lead intro-level classes at nursing colleges, typically on a semester-by-semester basis. Pros: teaching nursing students can be incredibly rewarding and a great way to give back to the nursing community. Cons: you'll most likely have to commit to teaching a class for an entire semester, and you might need a graduate-level degree for this work. Earning potential. The average pay for adjunct nursing instructors is $40 an hour. How to get started. To become an adjunct instructor, reach out to local nursing schools or online programs to see if they have any open positions. 2. Camp nurse. If you're looking for seasonal work that feels very different from a traditional doctor's office, look no further than camp nursing. Camp nurses serve as on-site healthcare professionals for all kinds of seasonal gatherings, from recreational summer camps for kids to business retreats for adults, and provide basic medical care for injured or sick campers. Pros: enjoy being a nurse in a beautiful, fun, and nurturing environment. Cons: the work is seasonal. You may need to live on site at the camp, and you'll likely be responsible for a large group of campers. Earning potential. On average, you can earn $39 an hour as a camp nurse. How to get started. Submit your resume online to organizations like American Summer Camps, the Alliance for Camp Health, or Camp Nurse Jobs. 3. Child care worker. Your nursing credentials in life-saving procedures like CPR, first aid, and the Heimlich maneuver make you a standout candidate for babysitting and nannying. Pros: working with children is fun and can be very rewarding. You can create great relationships with families and watch children grow. Cons: while fun, this work can be tiring and might conflict with full-time nursing shifts. Earning potential. While childcare pay varies depending on where you live and the type of work you're doing, the average hourly rate is $16 an hour. How to get started. Offer your services to friends and family, or sign up for organizations like Sittercity and Care.com to advertise to parents in your area. 4. Clinical research nurse. Clinical research trials typically need trained healthcare professionals to help coordinate between researchers and volunteer patients. In clinical research nurse jobs, you may recruit and onboard patients, administer treatment, conduct in-person focus groups, collect and organize data, or oversee compliance with local and federal regulations. Pros: you can help develop new treatments that directly support patients and positively impact their lives. Cons: you might need a graduate-level degree for this work, and managing compliance and timelines could be stressful. Earning potential. On average, you can make $44 an hour as a clinical research nurse. How to get started. To get started, look for job boards at healthcare facilities where you've worked to see what clinical trials are being done in your area. 5. Nurse consultant. With your experience as a registered nurse, you have valuable insights about best practices in the healthcare industry and the nursing field. Many teams seek medical expertise to improve their operations. Healthcare organizations, colleges and universities, and even screenwriters on medical-based films and TV shows can all benefit from a nurse's expertise. Pros: nurse consulting is flexible nursing work that pays well. Cons: you'll have to find and keep a steady stream of clients. Earning potential. You can expect to earn an average of $44 an hour as a nurse consultant. How to get started. First, ensure you have the necessary certifications and education required for the type of nurse consulting work you're looking for. Then, advertise your services on places like LinkedIn. 6. CPR on first aid instructor. Many workplaces and organizations require their employees to receive CPR certification or training in first aid, creating many opportunities for you to teach. Pros: the classes are usually only an hour or two and often follow the same curriculum each time. Cons: you'll need to find transportation to each class, and travel time could be long. Class times and locations might be inconsistent. Earning potential. Expect to make between 37 to hour on average. How to get started. With your clinical experience, you can advertise your services to local businesses, offering to visit and provide lessons and demonstrations. 7. Health coach. Health coaches work one-on-one with clients to help them set and achieve personal health goals. Being a registered nurse gives you a major advantage as a health coach. When building your practice, you can offer general consulting or specialize in fields like sleep consulting, lactation consulting, fitness coaching, acupuncture, or the birthing process. Pros. Health coaches enjoy flexibility. They can set their own hourly rate and build followings on social media sites like TikTok and Instagram, potentially earning money as an influencer. Cons. Depending on how you start your business, you might have to build it from the ground up, which can take a lot of time and energy away from your full-time nursing job. Earning potential. Hourly, the reported average is 20 an hour, though your total earnings can vary widely depending on how you market yourself. How to get started. Complete a health coaching certification, available from a number of organizations, to boost your services. Then, start by advertising your services online on sites like LinkedIn, build a website for your business, and create a social media profile. 8. Health writer. If you have a knack for writing, use your nursing background to position yourself as a freelance writer for health websites, blogs, journals, magazines, or social media pages. You can also serve as a subject matter expert, a medical professional who reviews health-related content written by others to verify its accuracy. Pros. Freelance writing boasts flexible hours and fully remote work, making it a great choice as a side business. It's also a great side hustle if you're an introvert, allowing you to earn money from home while spending some much-needed time alone to recharge. Cons. Depending on the type of work you take on, medical writing can take up a lot of time, and tight deadlines could be difficult to meet with your other responsibilities. Earning potential. Your earning potential as a freelance health writer will vary based on the clients you work with, the type of projects you take on, and the payment structure you ask for. Some people will charge on a per-project basis, while others might go with an hourly model. On average, you can make 39 an hour as a health writer. How to get started. Look into online job boards, Slack groups, or communities for freelance writers. Superpath is a great option for looking for freelance work within the healthcare or nursing niche. Post on LinkedIn to see if any companies are looking for freelancers with your expertise, or reach out directly to companies in the health and wellness space. 9. Home care nurse. Many nurses provide healthcare services to patients outside of a hospital context, administering care and assisting with daily life. In-home patient care is especially common among elderly people, people with long-term illnesses, and people with disabilities. You can offer your expertise in particular treatments or conditions to find patients in need. Pros. Create patient relationships, work with a diverse group of patients with different needs, and make a true impact on your patients and their quality of life. Cons. You might lack the necessary flexibility or equipment you need. Earning potential. You can expect to make around 36 an hour as a home care nurse. How to get started. Join an organization like the Home Care Association of America or the National Association for Home Care and Hospice. 10. Immunization nurse. Immunization nurses administer routine vaccinations to patients, offering their services part-time in hospitals, clinics, or pharmacies. Pros. You can pick up more hours during spikes like flu season, where vaccination spots see significant walk-in traffic. Workplaces and schools may even hire immunization nurses to vaccinate employees and students on site. Cons. It'll be up to you to deal with adverse vaccine reactions and soothe nervous or upset patients. Earning potential. The average hourly rate for immunization nurses is 39 an hour. How to get started. Aside from staying up to date on vaccine information, apply for a role as a vaccination nurse online at sites like Vivian. 11. Medical transcriber. Many businesses employ transcribers to turn audio or video into written documents. Pros. With your nursing education, you are uniquely capable of decoding medical terminology, jargon, and acronyms in healthcare recordings and medical records. Cons. Depending on the recording quality and how clearly participants speak, deciphering each audio file could be challenging. Earning potential. The average hourly pay for medical transcribers is approximately 21 an hour. How to get started. To get started, apply to be an in-house medical transcriptionist for a hospital. Build a website advertising your services as a freelance transcriber, or apply to a medical transcription firm. 12. Medical survey taker. For an especially flexible schedule that lets you work from the comfort of your couch, consider answering paid medical surveys. Survey websites like ZoomRx and MedSurvey want survey takers with experience as healthcare providers. Pros. Taking surveys allows you to earn a little bit of extra money without leaving home. Cons. This can be a large time commitment. You may not qualify for every survey you're interested in taking, and they might not pay as much as other side hustles can. It really depends on the survey and the company running it. Earning potential. While rates seem to range quite a bit, one source quotes $1 to $6 per minute for computer surveys. How to get started. Sign up on a platform that offers medical surveys like ZoomRx, MedSurvey, InCrowd, Focus Group, and M3 Global Research. 13. Per diem nurse. Per diem nurses, meaning by-the-day nurses, are supplemental staff who pick up shifts at hospitals, often on short notice to respond to higher patient traffic. Pros. Because the requests are often last minute, per diem nurses typically receive a higher wage than permanent nurses, so it's a great way to make some extra cash. Cons. Per diem roles are unpredictable, so it might be difficult to commit to last-minute shifts if you already work as a full-time registered nurse. Earning potential. Nationwide, the average hourly salary for per diem nurses is $33 hour. How to get started. To become a per diem nurse, talk to fellow nurses and supervisors at hospitals in your area, or register with a per diem staffing agency like NurseFinders. 14. Telehealth nurse. If you want to continue your nursing career from home, try telehealth nursing. Telehealth nurses use video conferencing to assess and assist patients remotely, often working with patients in the healthcare system who live far from the hospital or who struggle to afford in-person appointments. Pros. Telehealth nurses have the highest average take-home pay of any other nursing side hustle on this list, making it an excellent option as a nursing side job. Cons. If you're someone who thrives in an in-person environment, telehealth nursing might not be the right fit for you. Technological difficulties and the inability to connect with patients who don't have access to technology can also be difficult. Earning potential. Telehealth nurses can earn higher wages per hour, with the average take-home at $89 hour nationally. How to get started. To become a telehealth nurse, look for telehealth positions at any previous hospitals you've worked at, or apply to telehealth-specific positions at online specialty clinics. 15. Nursing tutor. Did you pass your NCLEX RN with flying colors? Become a nursing tutor to help future nurses prepare for and pass the exam. Pros. You can set your own rates and hours as a nursing tutor, inspire and guide new nurses looking to go into the field, and keep your own knowledge up to date. Cons. This can be a stressful side hustle, as you'll be looking to ensure the success of your students. Earning potential. The average hourly rate for nursing tutors in the U.S. is $20 an hour. How to get started. Advertise your skills at local nursing colleges or online to provide one-on-one or group tutoring services. Side hustles for nurses. FAQ. Can I work a side hustle with a full-time nursing job? Depending on your employer's policies, you can work a side hustle with a full-time nursing job. Your medical training makes you a standout candidate for child care or CPR/first aid instruction, and your excellent communication skills are a great fit for tutoring, teaching, and coaching. For low-key work that lets you set your own hours, try answering medical surveys, working as a health writer, or doing medical transcription. For more scheduled nursing work, you can work as a telehealth nurse or online health coach. Is it legal for nurses to have side hustles? Yes, it is generally legal for nurses to have side hustles, as long as they follow their employer's policies on taking on contract work. You should consult your HR department to make sure that your employer allows for outside nurse consulting and to see whether they place any restrictions on it. What should I consider before starting a side hustle? Think about what you're actually interested in doing, how much you'd like to make per hour, what your skills are, whether you'd like to work from home or in person, the amount of time you have available, and whether you have the energy to do it. How can a nurse make extra money on the side? Several side hustles will put your nursing skills to work. For remote options, look into telehealth nursing or answering medical surveys. If you enjoy teaching, try working as a tutor or adjunct instructor for nursing students. For a break from the familiar nursing environment, check out camp nursing or childcare. How can a nurse work from home and make money? For low-key work that lets you set your own hours, try answering medical surveys, working as a health writer, or doing medical transcription. For more scheduled nursing work, you can work as a telehealth nurse or online health coach. Do nurses have transferable skills for side hustles? The skills that you build in the nursing profession are transferable to side hustles. For instance, your medical training makes you a standout candidate for childcare or CPR first aid instruction, and your excellent communication skills are a great fit for tutoring, teaching, and coaching. Please subscribe and hit the like button.